before we start, I just wanted to you know have an understanding about your understanding about public health in terms of like what as a public health professional you are supposed to do, and what are the functions in which public health could be useful in terms of when we are doing research. Yes. Like when you will be finishing your public health, what type of a knowledge set and skill set you need to have, and how you are going to use those knowledge and skill set in order to become an accomplished public health professional, and in what are your areas of interventions and areas of your practice, your scope of practice. Yes.
Uh, Sir, may I?
Yes, Dr. Vikas, please.
Sir, I'm already working in the field of public health. I work for WHO as an NTP consultant in National Public Health Program, that is National TB Elimination Program.
Okay.
And before that, for 6 years, I was a surveillance medical officer in
Okay.
field of public health only in polio eradication program.
Okay.
Yeah. And then, sir, I think by having a master's degree in public health, we we are able to at least it's a feather in the cap in our already existing knowledge and degrees or diplomas. Plus, I will be able to handle the um, national programs in the field of making policies at various levels, like national level, state level. Plus, I will be able to do monitoring, evaluation, data analysis, research,
Okay.
etc.
Okay.
In a better way. In a better way. And
Okay.
we are having
So,
operational research like things in the field of NTP. We are already doing into
so Dr. Vikas,
NTP.
have you, as a part of your work, have you been involved in any public health research directly?
Yes, sir. I was involved in the implementation of the this national COVID zero surveillance program, which was
Okay.
held about 2 to 3 years back in the
Okay.
state of Uttarakhand. I was directly involved
Okay.
in that. I used to
Okay.
assist or facilitate them because it's a difficult terrain and there were difficult times of COVID times. Then to assist the team in keeping their morale high, or to assist in the transportation of the samples, to arrange their, I mean, in a cold chain in Dehradun, and then
Okay.
transportation to the lab, etc.
Okay. Okay. So, taking cue from what Dr. Vikas have said, yes, Binti, what is your take on uh, what are the different areas or disciplines that are being used to have a good understanding about public health? Because for research, that is very much important. So, like, suppose you have done homeopathy, right? And now you are doing masters in public health. So, when you are doing masters in public health, which are the areas that you feel will play a very important role in your understanding about the public health problems of any society or community, to make certain type of interventions in the community? Like, for example, Dr. Vikas said he is working with tuberculosis, okay, and he was a surveillance officer before, and now he's working in the national health programs. So, like, suppose you have done homeopathy, how you are going to use your knowledge from homeopathy and what you are going to study in public health to make intervention as a public health research officer, suppose. Because see, unless and until you understand the soul of any program, unless until you understand the soul of the subject, that subject you can never imbibe. within yourself. Okay, so we need to understand so that before we go and move into research methodology and biostatistics per se, you should have a clear cut understanding. Yes, Binti.
Sir, I just want to um
Okay,
currently.
I will put the question in another way.
Okay, sir.
You are pursuing masters in public health. Which domain knowledge is very, very important for you to become a successful public health specialist to do a good research? Since you have the background of medical subjects, okay, you have studied anatomy, you have studied preclinical, you have studied paraclinical, you have studied clinical subjects, okay.
Yes,
So,
yes, sir.
so as a public health officer, tomorrow when you will be you're pursuing your masters in public health, where do you think, in which
Yes,
areas you are going to enhance your knowledge so that you can use these things for solving the various public health problems of the society?
uh, sir. I just want to currently now I have only completed my AIHMS degree, so I just
Okay,
want to. Uh, I didn't do my postgraduate, so I just want to. Uh, I just
okay,
want to add another degree. So
okay. Anybody else? Priyadarshini, Premi, you want to add on something? Have you understood my question? Because see, now we will be studying regarding research method, because research methodology and biostatistics are hand in glove. You cannot separate research methodology from biostatistics, and you can separate biostatistics from research methodology. It's a very important component. So you have to understand the public health problems of any society in order to overall understand the intricacies and the different aspects. So that's why I put up this question: which knowledge domain, which knowledge, what type of a knowledge you need to have, which subject knowledge you need to have to become a good public health specialist to resolve the public health problems, and what are your will be your areas of intervention? Yes, Priyadarshini, any input from you? Like you have done dentistry, and you have got public health dentistry also. So why did not you go for public health dentistry, MDS in public health dentistry, and why you wanted to pursue MPH?
Yes, sir.
Hmm.
Sir, maintaining oral hygiene.
Okay. So if you want to, if suppose in a community you want to maintain an oral hygiene, take say, okay, you want to, let us take about issues about oral cancer. Okay.
Yes, sir.
Now in oral cancer, as a public health specialist, what type of a knowledge and subject knowledge you need to have to become a public health specialist?
Yes, sir.
Because you have studied dentistry. So naturally, you might think, okay, since I've studied dentistry, I need to have a knowledge base about these subjects and these subjects from, and then I need to see all these subjects from the paradigm or from the scope of, from the lens of the research methodology and biostatistics.
Yes, sir.
Because see, we are here to get knowledge. We are here to discuss something very important. That's why before I plunge into and I deep dive into the actual subject matter, I want to understand your mindset and I want to understand your understanding about that area. So that once that fog is gone, that you are able to see through, the things become very easy. Okay. Hmm. Yes, Priyadarshini, you want to add something on to this?
Uh, Sir, prevent oral carcinoma, just like oral cancer, and
Okay. So one area is prevention. So you are saying prevention is one area. Okay. Hmm. So if you want to prevent oral cancer, what type of a subject knowledge you need to have so that you can do you can become a good public health specialist from the research perspective. Hmm. Okay, no issues. Yes, anybody else? Yes, coming back to Dr. Vikas, you want to add something like from the my question is very specific. Suppose related with oral cancer, what type of a skill set a public health specialist need to have? Subject knowledge domain about which areas?
Sir, I think the various practices of the oral, which affect the oral hygiene in a particular community, like betel nut chewing
Okay,
or smoking or tobacco chewing
okay,
in a particular community, or
okay,
various methods by which we can make them aware so that I mean they don't suffer from it.
okay,
Or I mean these type of things, they may, which all the things which may lead to oral carcinoma, or which all the things which may predispose the community as a whole to oral carcinoma. Plus, what are the steps or the measures that we can take to prevent people as a community from having the oral carcinoma?
okay, okay. So
That's
now
what.
suppose okay, okay, thank you. Now see, if suppose I am a public health specialist, I and what is written over here, if you see, like statistics is the science which is concerned. Now research methodology and statistics, you cannot get it separated, right? So now if it is a science which is concerned with scientific methods for collecting, organizing, summarizing, presenting, and analyzing data. So now, as you know, like data is very, very important for anything. Like you now you have got data science everywhere. Okay. Now, if I am a public health specialist, suppose if I am a public health specialist and I would want to see, so I would say, okay, maybe I need to have a very good knowledge about epidemiology. I will see, okay, let me think from a perspective of epidemiology that what exact topic I want to focus upon, what are the that exact area when I want to focus upon. So how what are the different aspects of those disease, which target population you are talking about, whether you are talking about in adolescent, whether you are talking in terms of adults, whether you are talking in terms of children, whether you are talking of terms of female. Okay, then I need to understand those aspects in terms of economics. As a public health specialist, I will think like, okay, what is the impact of this problem in the society? What, how do we see in terms of productivity? How do we see in terms of disease burden? How do we think in terms of societal impact? How do we see in terms of the financial aspects? How does it impact the whole family? So there could be different ways of looking at it, because this is a very important part in developmental economics. The third area I can see as a public health specialist, what about the behavioral science? Like what makes people chew tobacco, take tobacco, the addiction part, what are the various components of it? Why people have this type of a behavior? Whether it is learned since your childhood or it is adapted over a period of time, or whether what are the risk factors which are involved in this. So you have to understand those mechanics as well from a public health, because public health is very different from a clinical side. So as a public health specialist, you have to see it through the lens of various specialities. So the first one is epidemiology, the second one is economics, the third one from the area of behavioral science, The fourth area could be from the aspects of anthropology. Like if I take the same topic and see it across India state by state, or if I take the same topic and see across the world to the different parts of the world, how the we take the issue of oral cancer in Southeast Asia, how we see the same problem in Africa region, how we see the same problem in the Western world. So definitely the same answers won't suffice for the same problem everywhere. So as a public health specialist, you need to have a clear cut, answers to your problems in these manner. So your knowledge about epidemiology, economics, behavioral science, anthropology, then your knowledge in terms of the health policy. So there are different, your research methodology, biostatistics. So you are using all these specialities to do ultimately to do what? To collect, organize, summarize, present, analyze, conclude your data in terms of public health. Now, in public health, when you speak in terms of public health, there will be probably different areas of public health where you will be working. Like when I was speaking to Dr. Vikas, he told he was first working as a surveillance officer, now he's working as in a consultant position. So definitely the job responsibilities. So now whether you are working in the area of health protection, now suppose I am working in the area of health protection. The second area within public health could be health promotion. Health promotion. The first area is health protection. The second area is health promotion. The third area is health system strengthening. When you talk in terms of health system strengthening, it itself is a very big area of work, because health system strengthening will work with the governmental levels, because it basically integrates the implementation network. Like whether when you are working with the government, it talks about what is the management level of the government, what is the accountability of the government in resolving those problems. What about the manpower aspects of the health system? Like in India, we have got the three tier system. Okay, primary, secondary, tertiary, and then quaternary also. So there, when you talk, like when the Bhore committee came into being, the biggest problem in India right now, what was in 1947, when the country got independence, still we have not been able to achieve those targets in the last 70 years. So the biggest problem is the government itself was unable to resolve the issues, and that's why in India, major chunk of healthcare is been pushed by the private players. So we need to see whether the gravity of the problem is same in tier 1 city, tier 2 city, tier 3 city, tier 4 city, whether the gravity of the problem is the same, and whether it's same or different. If it is different, why it is different? What are the causes for the issues that we see around us? Then what like in health system, I was telling you, what is the impact of the government? What about the manpower? What about the financing mechanism? Whether the government itself will finance. Now, what is the current GDP of India? Now, suppose I make you the head of a cancer project with any of the NGOs. Now, you need to raise funds for running the program. So my concern, and who is the biggest financer for all these projects? The government. So for spending, you first need to earn. So my question is, what is the current GDP of India? Yes, who can tell me? What is the GDP of India? Yes, Dr. Vikas.
नहीं सर, अभी आइडिया नहीं. I'm trying to.
Okay. अभी इंडिया का the GDP of India is almost like 320 lakh crore. Okay. 360 लाख करोड़ इंडिया का जीडीपी है।
जी
इंडिया के ऊपर आज की डेट में आपको पता है कर्जा कितना है? 205 लाख करोड़। देखिए, जो आप कमाएंगे वही आप खर्चा करेंगे। अगर आप कमाएंगे नहीं, इफ यू आर नॉट अर्निंग, फ्रॉम वेयर यू आर गोइंग टू स्पेंड? So you also need to understand the financing mechanism, how the government allocates the funds, from where does it get the money? If the money, whether the government will take it from RBI, whether the government is going, because at the end of the day, like next month the budget is going to pass. So if you are a public health in charge, your research and your understanding about public health has to be what are the financing mechanisms, from where the government is going to get the money, whether the government is going the whether, because we have a federal structure, so the center, whether the center is going to get the money or the state is going to get the money on itself, or whether it is going to take loan. If it is going to take loan, it is going to take loan from the banks of India, or it is going to go to World Bank. If it is going to World Bank, why the World Bank should support India? Or those states are going to individual agencies like Melinda Gates Foundation, UNAIDS, or certain other bodies. So these are very important questions that you need to understand from a so third was financing. The fourth was access to medicines, diagnostics, and because unless and until you have access to, so in one of the lectures I told, when we talk in healthcare, we talk about the 3 A's of healthcare: affordability, accessibility, and um accessibility, affordability, and the third one is access. One more. What is the third one, Dr. Vikas? Accessibility to healthcare?
accountability ne?
No,
No.
not accountability. Accessibility, affordability. Oh, yeah, availability. Okay. If it is
Yeah,
the first
okay.
thing is whether it is accessible. If first it is available. If it is available, then whether it is accessible or not. And whether if it is accessible, whether it is affordable or not. Okay. So you also need to see the healthcare services from these lens. This is very, very important component. And then comes, so I told you, like the first one is health protection. So as a public health specialist, you can work in the area of health protection. So it's a bigger domain, there's a bigger umbrella. The second is you work in the area of health promotion. The third one, you are working on health system strengthening. And the fourth one is health intelligence, which is the latest and by far the one of the most important and the most powerful component in the areas of public health now, because health intelligence will talk about data. And like I said earlier, what is the purpose of data? Data has to be converted into, like, suppose we have got data for tuberculosis, we have got data for HIV/AIDS, we have got data for Kala Azar, topical neglected diseases, maternal and child health. So there are 20 different areas in public health where you can work. You have to specify which is your area of specialty and what is your understanding about that problem. So while you are working in those areas, data is, because you need to understand, now data is the next gold mine of the world. So people are collecting data through Aadhaar, people are collecting data through your bank accounts, your age. If we are doing surveys, we are doing census, but these data, so ultimately data has to be converted into information. So what is the purpose of data? Because the purpose of data is data has to be converted into information, information has to be converted into knowledge, and knowledge has to be converted into wisdom, so that we don't make the same mistakes again and again, so that at a policy level we understand that who are our stakeholders, for whom we are making these policies, how it is going to affect them, how it is going to change their lives, how it is going to eradicate the bigger issues, how it is going to protect the health of the people, how it is going to promote the health of the people. So protection of health of the population and promotion of health of the population are the biggest goals. For doing those things, you need to strengthen your health systems. And to strengthen your health systems, you need to have a health intelligence. So, in order to achieve these goals as a public health specialist, you need to have a thorough understanding about the science and the technique and the knowledge and everything regarding your research methodology and biostatistics. Is it clear to everyone?
Ji, sir.
Okay. And why we are doing it? For making reasonable decisions on the basis of this analysis. Okay. So you are going to make a reasonable. So if you are doing this thing, so it is going to help you. Okay. So what is the function of statistics? Okay, let me just clean the. Where is my eraser? Okay. So for this, suppose any problem you want to do a study on tuberculosis, you want to do a study on Kala Azar, on, like, suppose if I give you 1 crore, 2 crore rupees, whether you want to use that money for resolving problems related to malaria or Kala Azar or HIV/AIDS, or so you really need to have a clear cut decision making. And for doing a decision making, you need to understand data and what are the implications of data. So for research methodology and bastard, what are the functions? The functions are, it will help us for condensation of the data. So statistical measures help to reduce the complexity of the data. Like this, now the present world is big data analysis. You have got artificial intelligence, deep machine learning. So it is helping us to understand complex data. Okay, because see, previously what was used to happen, the doctors didn't had any knowledge about the technology, and the technological guys didn't understood medicine good enough. But this gap has been, it has reduced phenomenally in the last 2 decades, and that's why we are being able to solve very complex. Because see, I will give you a very interesting story. When was the first vaccine was discovered in this world? Yes, Dr. Vikas, because since you are
Uh,
the most experienced among them, so I will start a lot of questions with you.
in 1922, BCG or something else, or
And
before
not in
that even.
1922. Okay, and why the first? I will tell you the story. It's a very interesting story. So when the first vaccine, and why did the first vaccine came into this world? Okay, the first World War was took place in from 1914 to 1919, and almost like in 1918, the I think the Spanish flu came, which took almost like 5 crore people lost their lives in Spanish flu. It took almost like 20 years to develop the first vaccine, because Eli Lilly was the one, you know, where the first vaccine was developed as such in the industrial world. And Merck, Germany, was the first who made this vaccine in the year 1943. So almost like 20 years of the disease, the vaccine came. But now when you see, and then after this, not the first vaccine, the antibiotic. Sorry, I was talking more about the antibiotic. So the first antibiotic was came into this world in almost like 1942 or so. So what I'm trying to tell you is, it took almost like 20-25 years of research. But when you took this corona, and so it was developed just during the phase, because now we have got technology, we have got data, we have got good cooperation among the world. So what the world has changed, and with the computers and technology, we can understand very complex data in a very beautiful manner. And then there is a lot of data from around the world. So statistical measure will help to reduce the complexity of the data and understand the quantum of those data and how it is being applicable in our lives. What is the implication in terms of disease? What is the implication in terms of its etiopathogenesis? What is its implication in terms of the impact of the problem? What is its implication in terms of its management? Or whether we are going to how difficult or how easy it is to manage it, to prevent it. So these things have become very easy with understanding of research methodology and biostatistics. Then it is helping us for comparisons through classification, tabulation, through, so we have got now different types of tools, like for example Power BI, we have got R Studio, we have got Stata, we have got SAS. So it is helping us to compare data. Like for example, what was the scenario, 20 years before? What is the scenario now? Like for example, a major shift has taken place post COVID in India in the last 2 3 years. Can any of you tell me what is that shift in the Indian healthcare system? If I compare from in the uh, last 5 years data, 5 or 7 years data, where is the shift we are seeing in the Indian healthcare scenario? Can any of,
I think
if you are reading newspapers,
the-
you must have gone through those news. Yes.
this, I mean, I think jump in the production
Because your voice is breaking. I, it is not, Sarah. Yeah, because your voice is breaking. I'm unable to hear it properly. Is my voice audible to everyone? Hello.
Yes, sir. Yes, sir. It's
Yes,
audible.
sir. Yes,
Okay,
sir.
okay. Okay, yes, Binti, do you want to, what is the shift that we are seeing in the Indian healthcare scenario? Any idea? Do you read newspapers, the economic section? Because since you all deal with the area of public health and you are from the field of medical sciences, that's why I'm putting up this question.
I think it's in the production of the number, increase in the number and quantum of the production of vaccines. That is one field, what I observe.
Okay,
And,
okay.
and allotment of more a part of the GDP towards the healthcare system by the governments.
Is it so?
At least I think there's no
You
dearth in
go and
NHM for
see,
the funds for.
okay, you for that, you do need to do a differential, comparison
Yeah.
about, what was the budget earlier, what was the allocation of the budget, how much budget was spent. So, the major shift is now there is a huge FDI which is coming into the Indian healthcare sector. And for the last 2 years, like for example, Blackstone, okay, like for example, the public equity fund of Singapore, they have invested like almost like 16,400 crores for taking up this Manipal stake in the Manipal group. And likewise, if you see, almost like 8 to 10 biggest players of the world, they have invested into the Indian healthcare sector in the private equity. This was never before 10, 20, 30, 40, 50 years before. But post COVID, something has changed. And that's why people are putting this huge amount of FDI. Like for example, Manipal Group took up stakes in a GCC based, this one Aster Sanat, Aster Group. It took up one stake in Aster Group. Similarly, people are buying stakes in Hyderabad groups in South India. So if you read up the stories in the last 1.5 years, lot of foreign investment and huge foreign investment is coming. So can any of you can tell me like why it is coming and what has changed post COVID and why suddenly people have become so much interested in the Indian healthcare system, especially the private players?
Maybe because after seeing the performance of the private players in vaccine production and its utilization and its export to other countries, and probably the acceptance of the government of the foreign players in various things, maybe through Make in India like thing.
Okay. Okay. Anybody else? So now suppose, okay, because what I'm trying to push is to think critically. Now suppose if I'm a private player, okay, and I want to invest my money into your company, like take India as a company. So what is the biggest, lure for any private company? What is the objective?
The objective of any private company is that what it gets in return. I mean,
That means profit. भाई
yeah,
पैसा
profit.
चाहिए ना, पैसा बनाना है, right?
जी.
I want to make profit, right? So
Plus, I think there are many philanthropist companies that like BMGF or something who want to just see how better their fund is utilized for what it is meant for.
but if
That is,
if I see from those perspective, Africa is a more lucrative market, isn't it? Because if you see the whole of Africa, there's more. India still have got a reasonably good healthcare system because in terms of papers, okay, but when you critically evaluate it, it is not. There are n number of research papers on this. So what I'm trying to tell you is, post COVID, how much were the COVID deaths in India during the Corona period? How much COVID deaths took place in India during the Corona period? Any idea?
maybe around, I think, deaths around 5 lakhs.
That the government says. But what does John Hopkins and other research papers say? The best of the research papers in the world. The best of the John Hopkins, it is around 46 lakhs. Okay. So it exposed that. And this is where, because they understood that even the Indian, because see in India, I'll give you two examples. We have a population of 140 crores. Okay. How many mobile companies did you had in 2014 and how many mobile companies you have now for to cater to the need of 140 crore population? आपके पास आज की डेट में how many mobile companies you have? अभी इंडिया में अगर आप अपना मोबाइल चलाते कितनी कंपनीज अभी इंडिया में?
काफी है सर. BSNL अभी तो जो
अच्छा
BSNL
बताइए कितनी
BSNL
सारी हैं?
BSNL है,
BSNL है,
एयरटेल
ओके,
है,
एयरटेल
जियो
है,
है,
अच्छा, ओके,
और आपका वोडाफोन है.
ओके, वोडाफोन आइडिया तो इकट्ठे हो गए.
हाँ, VI वही वोडाफोन VI हो गया.
हाँ,
4 तो यही हो गई.
ओके.
और तो नहीं ध्यान आ रही हमारे इस एरिया में तो सर. इतनी है.
ये इतनी रह गई हैं. अगर आप पहले का
अच्छा
आंकड़ा
अच्छा
उठा
अच्छा.
लेंगे, इफ यू टेक अप द डेटा, so that's why I'm saying I'm raising this issue to make a comparison. Okay, let's talk about another comparison because I will come to healthcare because I want to make you see what is going around you, right? To understand like how to analyze the data and how to see the data. Okay, how many airline companies now you have to cater to the need of 140 crores. अभी इंडिया में कितनी एयरलाइंस कंपनी है?
सर वो
लोगों को तो
अपना इंडियन जैसे
आप
एयर
तो
इंडिया है,
फ्लाई करते हैं सभी, ऑल ऑफ यू फ्लाई, है ना?
एयर इंडिया, इंडिगो, स्पाइस
ओके
जेट
ओके।
और
स्पाइस जेट तो डूब गई,
अच्छा डूबी गई। अच्छा,
है ना?
और
जेट
और
एयरवेज भी
एक
डूब गई।
जेट एयरवेज तो खत्म ही हो गई थी पहले ही। एक से सिंगापुर वाली टाटा और सिंगापुर की जो जॉइंट वेंचर आ
वो
गया
तो
है।
वो तो आपका मतलब एयर इंडिया को भी तो एयर इंडिया हैज बीन टेकन बाय टाटाज नाउ। इंडिया, द गवर्नमेंट डज नॉट ओन अ एयरलाइन कंपनी,
जी 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 वो
so that means technically speaking you have got only two airlines companies, Indigo and your Air India, that is Tata owned. Tata
जी
has ventured into other, और कोई है ही नहीं एयरलाइंस, देखो आप।
जी जी
Okay,
जी।
how many hospitals are catering to the need of 140 crore population?
अब सर
How
हॉस्पिटल्स के साथ साथ तो बहुत सारे जैसे हेल्थ केयर इंस्टीट्यूशंस तो हैं, प्राइवेट हॉस्पिटल्स हैं, बिगर कॉर्पोरेट हॉस्पिटल्स हैं, गवर्नमेंट
exactly?
के
So
तो जो
how मतलब how many private players, big private players do you know who are catering to the need of 100 crore population?
फोर्टिस तो है,
Okay,
टाटा,
okay.
फोर्टिस,
Hmm.
एस्कॉर्ट्स तो मेरे ख्याल से खत्म हो गया, पर एस्कॉर्ट्स भी है शायद।
Hmm.
और
एक सिंपल मैं आप आई एम टेलिंग यू स्टैट्स इन 2008 when we started the hospital administration public health program in Delhi. At that time we have got 6 to 7 corporate hospitals in Delhi: Apollo, Gangaram, Fortis, Escorts, Artemis, Max. Now in 2023, Apollo, Artemis, Primus, Max, Medanta, you have got Primus, Rockland, Sitaram, Bharti, Pushpavati, Singhania, Vedanta, Medicity, Columbia, Asia, Paras, Narayana Health, Care
मेरे को
Hospital,
कपूर कपूर हॉस्पिटल भी सर
PL
उधर वो
Kapoor.
वही
So if you take
पीएल
the
कपूर
list,
या
you can count almost like 30 to 40 hospital chains, big chains. Yes or no?
जी
So
जी जी।
somewhere down the line, people understood that healthcare market in India, to cater to the health needs of 140 crores, government is insufficient to provide healthcare when it comes to the mass level. It requires a huge network of the private players to cater to this. Say like AIHMS Yojana. When you see any of the government, आप कभी भी किसी state में जाएंगे and you ask them what type of a private network hospitals, like Dr. Vikas, when you go in and around in Madhya Pradesh, to implement the scheme of the government, do the government work with the private hospitals to implement their schemes? जैसे आयुष्मान भारत हो गया, all these things.
हाँ सर वो तो है, वो सभी स्टेट्स में है ना वो आयुष्मान भारत वाला।
Exactly. So that means government cannot cater to the government hospital alone to get, because it is our inefficiency which has led to the, because these needs cannot be addressed by the government alone. Like
हाँ
take
सर,
I will
प्राइवेट
take
मेडिकल कॉलेजेस भी बहुत सारे हैं।
exactly, है ना? प्राइवेट मेडिकल कॉलेजेस बहुत सारे खुल गए, ये है. सो बेसिकली व्हेन यू कंपेयर, टेक फॉर एग्जांपल, यू कंपेयर द इंडियाज मॉडल with the UK model. Now UK में तो हर चीज NHS के थ्रू है. What you are giving, everything is through the NHS. So their needs in India, suppose you have got some emergency, you can directly go to Apollo, Max, Fortis, Artemis, Primus. You can get your things done at 1/10 of the cost. But in UK, if you want to go, it is a phenomenal cost. But at the same time, NHS is not sufficient enough to provide healthcare efficiently to everyone because the waiting list is long. So for this, you need to understand the different healthcare models of the world to understand the efficiency and the effectiveness of the delivery of the healthcare. It will help you to compare the data. It will help you to understand the gray areas. It will help you to understand what are the target areas. It will help you to understand where should be the interventions have to be given. Okay, so again, this is a very important function of statistics and research methodology when you think from the perspective of public health. The third is forecasting. So when you forecast, you are basically predicting like how the healthcare market is going to change, how the disease pattern is going to change, what will be the burden of disease, what will be the purchasing power of your population, what will be the impact of the demography on those diseases. So by this, you are forecasting. And why forecasting? Because it will help you to understand and implement your policies in a much better manner. The fourth one is estimation. So one of the most important objective, like when you talk about something in a population, you talk about how much confidence you have, whether you are 99% confident or you are 95% confident. That means margin of error could be just 1% or 5%. So according to this, again, statistics is going to help you to understand the scenarios at a macro and a microscopic level. Is it clear?
जी
Okay.
जी
Okay. And then is the test of hypothesis. Hypothesis is an assumption about, so when we do any type of research in public health, we need to take a hypothesis, whether this is causing this problem. Like for example, आज की डेट में हम बोलें कि why uh, why our healthcare services are not being so effective in the last 70 years. Now, suppose if this is a question, or why the southern states in India are performing better than the northern states in India in terms of healthcare delivery of services. So that could be so whether it is related to education, whether it is related to the efficiency of the governments, whether it is related to the performance of the government, whether it is related to the understanding of the about your demography of that state, whether it is related to the industrialization of that state, whether it is related with the, so what are the factors responsible for the success? Why the Kerala model was more successful in managing corona as compared to other states in India during the corona period. So you can probably make a hypothesis, you can do a study, then you can do the findings, which could be used in a much effective and efficient manner for your learning at a macroscopic level. So there, hypothesis testing and all these things can be used effectively from a public health perspective. Is it clear to everyone? Okay, so we'll finish the class now, and I will be sharing this slide with you. And from the next class onwards, you can go through the slides in advance, and then we will discuss about all these things in more details.
right sir.
Okay.
जी
Okay.
sir.
Okay. Thank you so much. So we will meet. Okay, quite frequently. So I will ask Seema to have my classes, and accordingly we will discuss and we'll finish up the all the syllabus on time. Okay. How
Thank you.
about the classes with the other faculty members? How is it going? Like, has
So
it
in the
started?
morning there was a class on the on this uh, I'm in endocrinology. And it went well. It was nice.
Okay. Okay.
It was at around 11 a.m. It was there.
Okay. Okay.
So,
Okay. Fine. And if there are any issues, I'll also ask Seema to create that group, and there we can, think more deeply, and we can also do certain studies as well. Okay, at the same time, like
yes,
we can do certain studies on, and that it will also help you to make good research papers, writing, because see, studying the subject is one aspect, and writing a good research paper, publishing it. So you can have the entire practical aspect of studying this subject. Okay. So how to get a meta-analysis done? How
right.
about a network analysis? How do you do a systematic review and meta-analysis? How about you do a cross-sectional study? How do you do a interventional study? So like this, it will be quite interesting, and it is a practical way of learning of the things as well. Okay. Okay. Thank you so much.